The following program contains mature subject matter. Viewer discretion is advised.
A video has recently gone viral, and I have to warn all of you, what you see next might make you cringe a bit. What you're seeing here is something known as venipuncture. This is where you cut a vein to remove blood. Sometimes people call it bloodletting. This is used in certain cultures, Chinese medicine, on certain occasions. This is used for a lot of different things. I'm not saying that it's correctly used. We do not. I've never done this. I personally don't believe in it.
There's a better way.
There is a better way.
I mean, the hardest part is that he had a band. I don't know if you all could see it there. I think there was a band tied around his neck to increase. Of course, if there's a band tied around your neck, that blood can't return to your heart, so it has nowhere to go but out of the body. That's why you're seeing that continuous pressure.
Normally, a vein would be more of just a slow ooze. This is coming out. I thought this went out in the Dark Ages.
I mean, you know, I try to be respectful of different cultures and their traditions and things like that, but this is just wrong on so many levels. Like, that is not safe. That's just not safe. Was there even a blood pressure cuff on? Like, I'm just curious.
It looks like you were sitting in a living room somewhere.
Well, yeah, that's So
I've heard of Botox parties, but I've never heard of bloodletting parties.
There are very few scenarios where there could be a medical reason for getting rid of some of your blood, but for a lot of their uses, I mean, the other thing is to use it for pain. Let's just say you have an area where it's swollen and bruised. It's not like just popping open a vein, cutting into a vein is going to cause that swelling to go away. And that's one of the misnomers with this, that you can cut a vein in an area where you have swelling and all of a sudden the swelling is just going to disappear, because when there's swelling and contusions, that's bleeding into your tissues. Right. So anyhow.
Different from a hematoma. Hematoma you can evacuate with a needle or an incision, spread it and squeeze it out.
So if your healthcare practitioner recommends doing this, I would personally recommend finding a new healthcare practitioner.
Get a second opinion.